Metabolism. Metabolism is defined as the processes of biochemical reactions that occur in the body's cells to maintain optimal blood glucose levels and regulation of hormones that are associated with the endocrine system. Metabolism uh, is controlled by mainly the digestive and endocrine system. So much of the metabolic process occurs in the digestive system. But again, the endocrine system is also important and controls metabolism through the release of hormones. This regulates metabolism, growth, reproduction, fluid and electrolyte balance, gender differentiation, and other functions within the cells of the body. The body processes nutrients from food and drink and transports nutrients across cell membranes for use throughout the body. And this includes the digestive system, the entire GI tract from the mouth to the anus. The endocrine system controls the process of metabolism through release of hormones. The endocrine system is basically a messenger system. It consists of feedback loops that secrete the hormones as they are needed and then send them to the appropriate organs. The control center in the brain for the endocrine system is the hypothalamus. Hormones, once again, are those chemical messengers that are secreted by the endocrine glands. These include the pituitary, the thyroid, the parathyroid, the thymus, and the adrenal glands. The purpose is to regulate metabolism, growth, reproduction, fluid and electrolyte balance, again, gender differentiation, and other functions within the cells of the body. Metabolism can be decreased, homeostatic, which means that it is normal, it's where we want it, or it can be increased and can be viewed as being on a continuum. Homeostasis will occur when the body is functioning within proper limits and is also able to naturally metabolize. If we're hypometabolic, the major signs and symptoms that we might see would be chronic fatigue, gynecologic disorders, dry hair or hair loss, weight gain, bradycardia, hypotension, etc. Basically, everything is slowed down. Did you know that there is a direct correlation with a hypometabolic process and the brain's ability to break down glucose and the development of Alzheimer's, Parkinson's, epilepsy, and other neurodegenerative diseases? With hypermetabolic, the major signs and symptoms are going to be weight loss, tachycardia, heart irregularities or palpitations, shortness of air, anemia, and insomnia. So basically, with hypometabolic, everything is slowed down. With hypermetabolic, everything is speeded up. The hypothalamic pituitary axis helps control hormone regulation. The hypothalamus, once again, is the primary regulatory organ of the endocrine system. It detects signals from the brain as well as circulating hormone levels, and then it will adjust low or high levels by secreting those regulatory hormones that act on the pituitary gland. The pituitary gland, whether we have an increase or decrease secretion of additional hormones, those hormones are going to travel through the bloodstream to help regulate multiple major endocrine glands, which then regulate the function of all vital organs, and if functioning properly, are going to help maintain homeostasis. And that could not be done without that hypothalamic pituitary axis. Travel, especially across time zones, and we're looking at jet lag, for example, significantly impacts the HPA axis, which is a crucial neuroendocrine system that governs our stress response. This impact primarily manifests through the disruption of the circadian rhythm, and that in turn affects the regulation and release of cortisol. This comes from the adrenals, FYI. But cortisol is a key stress hormone that's produced via that HPA axis. That hypothalamus pituitary axis plays a central role in maintaining homeostasis by regulating various bodily functions through hormone release. It acts as a control center, receiving signals from the brain and the body, and then it directs that pituitary gland to release those hormones that influence other endocrine glands and body systems, ultimately contributing to the body's ability to maintain a stable internal environment. Populations that are going to be at risk for altered metabolism include pregnant women. Hormonal changes may cause insulin resistance and an increased risk for hyperglycemia. And the endocrine system is going to be responsible for sexual differentiation during fetal development. Another population at risk are infants and children. It's really important that we review the client's family history. These infants may be large for gestational age, and they would be at a high risk for hypoglycemia at birth. There is a higher risk for infants that have mothers who had diabetes during pregnancy. Excuse me. The small for gestational age or premature infants have a higher risk for hypoglycemia also. The thyroid should never be palpable, and if it is, it's always considered an enlarged thyroid or a goiter. If a metabolic disorder is found, that child and the child's parents are going to need extensive teaching for lifelong considerations. Growth hormone secretion increases progressively during childhood, peaking at puberty. The thymus functions to stimulate the production of T cells only in childhood and adolescence. Once the child has reached full maturity, the thymus does not stimulate this production. So what are T cells? They're a part of the immune system that is developed from stem cells in the bone marrow. They're specific antigen seekers, not general antigen seekers. They travel the body looking for their own specific antigen to latch onto. And we call this part of the cell-mediated immunity, whereas the B cells, for example, are part of the antibody-mediated immunity. They function by assisting the body to fight off infection and different types of cancers by using specific binders to that specific antigen. Adolescents are also at risk. During puberty, males release testosterone and females release estrogen. So, how do you think that's going to affect the adolescent's metabolism? Well, they're going through a high rate of growth. They're making bodily changes. Females are growing breasts. They're getting curves. The males are starting to develop some muscle mass, growing facial hair, etc. Their metabolism is going to be sped up. Older adults are also at risk. They have a decreased lean muscle mass with the reduction of the production of testosterone and progesterone. And this reduction in metabolism often occurs in the body systems where the breakdown of glucose occurs, correlating with the increased risk for metabolic diseases. However, it's really important to notice that normal signs of aging that occur within the endocrine system are decreased gland activity, which slow metabolism, and the thyroid can become nodular. We have some older adults who look at the symptoms of metabolic issues as part of the normal aging process. So it is very important that we do a proper assessment. Risk factors for metabolism issues or impaired metabolism include chronic insomnia. Getting adequate sleep is really important for the regulation of hormones, for the regulation of cortisol, estrogen, progesterone, insulin, leptin, ghrelin, melatonin, thyroid, and those growth hormones. Chronic stress is that overproduction of cortisol. Hypothyroidism or hyperthyroidism. Partial or total thyroidectomy. Liver damage due to alcohol or substance abuse. Obstructive pathology or disease processes. Genetic predisposition. Poor diet. Medications. Vitamin D deficiency. Obesity, or a lack of exercise. So health promotion strategies to help maintain a normal metabolism and prevent an impairment focus on maintaining a healthy lifestyle and practicing recommended healthy life habits, including a healthy diet and exercise. You're going to want to teach clients to avoid excessive alcohol and illicit substance intake. Teach clients who are at risk to have regular screenings done to help detect any potential problems early so that treatment can begin for control of those signs and symptoms. Remind clients to take medication and report signs and symptoms of worsening conditions. Tailor health promotion based on the developmental stage of the client. Can you base your health promotion strategies on the stated age? And if needed, make sure that you include family in these teachings to help encourage compliance. Alterations of metabolism do occur. They can be disorders of any part of the endocrine system, including the hypothalamus, pituitary gland, thyroid and parathyroid, and adrenal glands. Disorders of the hypothalamus may result from surgery, trauma, tumors, or radiation. The symptoms will be varied and widespread. There may be growth problems, hypothyroidism, dizziness or weakness, loss of vision or sleep, or appetite disturbances. Disorders of the pituitary gland may involve a growth hormone deficiency with slow growth and the child being shorter than other children. Acromegaly or gigantism. Acromegaly is actually a disease of the middle adult with the excessive growth hormone secretion, whereas gigantism is uh, too much or excessive growth hormone secretion prior to puberty, and the child will be much larger than other children. We also might see fluid depletion through diabetes insipidus or fluid retention through syndrome of inappropriate antidiuretic hormone or SIADH. Disorders of the thyroid gland are going to affect the metabolism rate. If we have hyperthyroidism, we have too much thyroid hormone. With hypothyroidism, we have too little thyroid hormone. Graves' disease is an autoimmune disorder that causes hyperthyroidism. Cancers can also cause hypo or hyperthyroidism. Disorders of the parathyroid can be due to too much or too little parathyroid hormone. It's related to the levels of calcium in the bloodstream and the bones. So if we don't have enough calcium in the blood, the parathyroid hormone is released and it pulls calcium out of the bones. Osteoporosis is linked to a disorder of the parathyroid. So let's look at this patient with suspected metabolic disease. Starting off with the interview, it's crucial in helping the client receive the diagnosis that they need to help start improving their health. Issues with the metabolism can have very vague symptoms, so it's really important for us to be on our toes looking for any potential symptoms. Older adults, once again, might look at metabolism disorder symptoms as normal signs of aging. It's very important to take a complete history with a focus on risk factors for impaired metabolism, looking at their diet, looking at their exercise levels, genetics, looking for any organ dysfunction, what medications do they take. And with all of this, include not only the client's history, but the family history and physical exam findings with diagnostic testing. With the physical exam, you need to complete a thorough and detailed physical exam to help identify any signs and symptoms that are associated with certain metabolic diseases or disorders, including the thyroid, liver or pancreatic problems. The physical exam is completed with inspection and palpation. With inspection, we begin by inspecting the skin, the hair, the nails, the facial appearance, reflexes, and the musculoskeletal system. In addition, you need to measure and monitor the client's trends in weight fluctuations, height, and vital signs. You need to note any changes in fat distribution, weight, and changes to skin color or texture. The only endocrine gland that can be palpated is the thyroid gland, and we palpate for enlargement or nodules. If you suspect the client has hyperthyroidism, we never palpate the thyroid forcefully or aggressively because it can cause an increased release of that thyroid hormone and lead to a thyroid crisis. Lab tests can help provide additional information regarding the overall health of the client. Many metabolic disorders are not observable. So some of the diagnostic tests beyond the physical exam include the hemoglobin A1C, which tests the blood sugar for up to 120 days in the past. It's a good test to determine how accurate the client's report is of what their average blood sugar has been. The T3, T4, and TSH, or thyroid stimulating hormone, will all help diagnose issues with the thyroid. We can look at individual hormone levels, serum electrolytes, liver enzymes, the bilirubin, serum albumin, and serum calcium. So as we generate that hypothesis with hyperthyroidism, we know that we're going to have issues with tachycardia, diarrhea, which could lead to a fluid volume deficit, malnutrition or insomnia. With hyperthyroidism, I'm sorry, that was hyperthyroidism. With hypothyroidism, it's going to be bradycardia, constipation, fatigue. With hypoglycemia, we have mental status changes and a risk for death. With hyperglycemia, we can also have mental status changes, but now we're also at risk for dehydration and respiratory acidosis. With osteoporosis, we're at risk for fracture risk, safety risk, poor self-esteem, immobility, and potentially skin impairment if that client decreases their uh, mobility because of a fear of falling or a fear of fracture. As you determine which hypothesis has the highest priority, it's really important to remember, always look at your ABCs first. So, airway, breathing, circulation. Then we look at safety and mental status changes second. We need to determine what is going to have the greatest effect to improve the client's status or save the client to determine what is our priority. Nursing interventions will depend on the cause and management of the metabolic impairment. Any metabolic disorder requires early and continued management and health teaching to help ensure adherence to the treatment plan. For example, the client who has hypothyroidism and requires thyroid hormonal replacement needs to understand not only the importance of taking the drug every day as prescribed, but they also need to understand it can take weeks before they start seeing improvement in the symptoms, so they need to continue taking the medication. It's very important to teach the client to avoid running out of the medication and wear a medic alert jewelry and carry a card specifying what drug therapy and disorder the client has. This is more important when we have adrenal issues and we have a low secretion of the cortisol. These clients are going to be on a lifetime replacement of steroids. And if they stop taking steroids, it can lead to what we call the adrenal crises, which is a potentially life-threatening issue. Independent interventions include education regarding the diagnostic testing, the disease, the therapies that are involved, the medications they might be taking, potential complications they need to be watching for, coping mechanisms, community resources, and lifestyle changes. Collaborative interventions include pharmacologic therapy, such as hormone replacement, insulin, oral medications, potentially for insulin sensitivity, biphosphonates, and other medications for osteoporosis. Non-pharmacologic therapy would include exercise, and this is where we involve the physical therapist. Potential changes to their diet, and we would pull in the dietitian to help set up a diet for the client, and maybe support groups. Complementary interventions would include things like acupuncture, meditation, yoga, massage, and nutritional supplements.